Welcome to the Northwestern Medicine Organ Transplantation Program, where we strive for patient-centric impact through quality, innovation, and education. As a top-tier institution, and in fact, one of only 4 universities and hospitals that rank in the top 10 nationally, we are dedicated to saving the lives of those suffering from end-stage organ failure by allowing patients equitable access to high-quality, leading-edge care. My name is Satish Nadig, and I have the distinct pleasure of serving as the Chief of the Division of Transplant Surgery and the Director of the Comprehensive Transplant Center here at Northwestern Medicine. Our program is one of the most storied transplant programs in the nation. The largest in the state of Illinois and one of the largest in the country, it is supported by a true multidisciplinary team made up of hepatologists, transplant nephrologists, transplant surgeons, and an army of nurses, pharmacists, dietitians, coordinators, and social workers. Together, we've established one of the longest-running transplant programs in the state. With high-volume expertise, superior outcomes, and access to international knowledge and talent, we strive to bring our innovative transplant care to patients closer to where they live and work. Our team is proud to have developed the first and largest access to care programs for both our Hispanic and African American transplant populations, with dedicated and targeted approaches to streamline the ability to not only receive organs, but to maintain the health of these organs in the long term. These culturally sensitive programs are dedicated to providing individualized care to patients and their families. We've expanded our team's approach globally by forming the first Northwestern International Transplant Exchange. This partnership not only allows us to collaborate with programs outside of the United States, but also to help developing organizations in their pursuit of transplantation programs. But our expertise does not stop there. Innovation and research have always been a foundational cornerstone at Northwestern Medicine, the host medical school to the father of transplantation, Dr. Thomas Starzl. In fact, we are one of the first programs in the nation to offer minimally invasive donor nephrectomies, and with over 90 active clinical trials, including our Freedom trials, we've seen the largest number of patients eliminate their need for anti-rejection drugs. We're also leaders in research for cutting-edge technology, such as nanotherapeutics, cellular therapies, and biomarkers to prevent the need for invasive biopsies to detect rejection. Our program receives one of the highest amounts of federal funding, including NIH funding for transplantation and transplant-related research. We take enormous pride in the translational research we conduct in the Comprehensive Transplant Center. This research truly takes benchside ideas to the bedside and back again, distinguishing NM transplant nationally and internationally. The experts at our Comprehensive Transplant Center are leaders in training the next generation of transplant surgeons and physicians. Our mentorship programs are recognized by the National Institutes of Health and create a pipeline program for aspiring transplant physicians and early career physicians alike. Our faculty members hold leadership roles in not only national, but international transplant organizations. We have one of the most competitive fellowship programs in the country that offers supervised autonomy and focuses on educating, training, and developing future generations of clinical and academic leaders in the field. At Northwestern Medicine, we are on the cusp of the next era of transplant, the era of technology and innovation. I'm reminded daily of how our entire team, from our clinicians to our nursing staff to our support personnel, strives to provide the best care possible for our patients and their loved ones. So, when asked, what sets Northwestern Medicine Organ Transplantation Program apart? My answer is simple. Our aim is to continually improve the field of transplant with compassion, ingenuity, and accessibility. We are committed, honored, and promise to deliver on that mission.